Hey everyone, welcome. This is Jason Clemens, Doctor of Chiropractic at the Rock Health and Wellness Center, and this is Life with Jason Clemens, DC. Hope you guys are doing great. It's great right here. We're live from the Rock Health and Wellness Center studios in Lubbock, Texas. We're live on 98.7 Walk by Faith Radio, 1420 AM. What are we doing? We're streaming on 987radio.com, and we're live on all of our social media pages, I think. Had a little trouble with that this week, but I think we got it all straightened out and we're good to go tonight. So hope you guys are doing good. Well, last night we got into a little bit of, mechanism of action of metformin. We talked about some x-rays. We finished up the article that we were talking about the night before. And tonight we're going to dive back into those x-rays a little bit more and talk about some of the things that are issues is interesting. A colleague of mine sent an X-ray to me today, and with an MRI report or an X-ray report, I guess it was just an X-ray report that went with it that recommended surgery. And I was just like, none of us. It was in a group chat, and we've looked at it, and we were like, none of us could understand why that surgery was recommended. So I think it's kind of cool to talk about these X-rays a little bit and talk about them. A lot of people think that they need to get an x-ray. Something's wrong with me. I think I need an x-ray. And sometimes x-rays are great. I mean, we take them all the time here at the Rock. But sometimes they're necessary. Sometimes they're not. Sometimes things are blamed on x-rays that aren't true. And I think we could talk through some of these, and I think it would be helpful to do that. And then I just had a kind of a quickening of my spirit a little bit today about sympathetic and parasympathetic, and how quickly I go over those things sometimes. And I just thought to myself, you say these things, but do people understand what you're talking about? And so I thought I might just slow down just a little bit tonight and just go over that one more time, because some of the things that we said on the show in the last few days about tone and the autonomic nervous system and sympathetic tone and parasympathetic, all that sort of thing. I just want to make sure you understand it. So I want to slow down. I want to slow down, and I want to go over it very clearly so that you understand it. So it makes a little bit more sense to you. And so yeah, that's what we're going to do tonight on the show. So I hope you guys will stick around. I hope you enjoy it. And we're just going to get right into it. If you got a question, send me a text, 806-794-0400. Send us a comment on our text line. I leave my ringer on in case people want to call. So sometimes we get calls in the middle of the show from different people. So but that's all right. That's why I don't want to turn that ringer off in case somebody wants to get a hold of me and while we're talking on either one of them, on my personal phone or on our cell phone. So we're live. We're bringing it to you live. I just got finished with patients 10 minutes before we started. Started this morning with patients at 7:30. Haven't stepped out of the building since 7:30 this morning. And but it's great. I'm not complaining. I'm just saying it's like that's what this show is about. This show is a show that is about bringing it to you live and real, and hopefully it makes some sense. So these are things we go over. These are clinical things we go over every day, and we deal with them. And that's why I want to deal with this X-ray with all this nasty looking stuff on the front of it, and hopefully you get it, because I want you to see it, and then I want you to understand it about what we're looking at and what effects it has on us. Because there may be some confusion about what effects it has on us. So you guys on the radio, you can go to the Walk by Faith Facebook page and check us out and see these pictures. I'll try to describe them the best I can, and we'll talk about them. So let's just look at this one particular X-ray right here. This is a lateral cervical neutral x-ray is what it's called. So lateral, and whenever you're dealing with x-rays, it's what direction is the beam going into the patient. So that's the frame of reference that we're working off of, the point of reference. So on a lateral cervical is your neck. So we're going to shoot the beam from shooting at your side, coming in from your side. So when you see this, you'll see like a jawline. On this normal one, it's a little bit zoomed out, and you can see here's the jawline right here. Here's the teeth, and there's the skull, and that skull comes around there, and then there's the cervical spine right there. And the very top of that cervical spine is the atlas. The atlas holds up the world. That's another thing I was going to talk about. Let me see if I got this article. No, it was from yesterday. Hang on, because there was a picture that Dr. Murphy had. He posted an old article. Dr. Murphy used to be, back in the old days, in the 80s, he was like the guru of all whiplash things. Like he taught seminars and all kinds of stuff on whiplash and motor vehicle stuff and accidents and all that. And so he taught, and so he's teaching this. He throws every once in a while. He'll throw us one of those old articles in there. Hang on, hang on. We got a good show for you tonight, if I can make it happen. So yeah, just give me 1 second and we'll make this work. Yeah, there we go. Because I wanted to show you this picture of what the atlas looks like. If I can, there it is. There we go. All right, so this particular article is talking about it's post-motor vehicle accident, alar ligament laxity, and the ligaments that are around your atlas and your skull. But I just wanted to come down here and show you kind of what if you were looking at C2 and C1 and your skull. So this little picture, let me make sure you guys are getting it. Yeah, that little picture right there that has the red line on it. So you guys on the radio, what we're doing is we're looking at you can look at it from a front to back or back to front picture of what the atlas looks like. And what C2 vertebra, this one right here in the middle is the C2 that looks like it has a little thumb sticking up. And that's called the dens. And so you've got this platform, and then you got this little thumb sticking up, and that's the C2. That's the second vertebra in your neck. But C1 has these little platforms in it, and C1 it's called the atlas, and just like Atlas holds up the world, you can see a picture of Atlas holding up the world. That's exactly what Atlas does. It's got these little platforms on it, and then your skull comes down here and sits on top of those platforms, and your skull slides in all kinds of different directions on that atlas, and that atlas slides back and forth on your skull. And so I always think of that as those old time as those older big computer monitors, like not this new stuff, but what they had, whatever, in the 90s or in the 2000s. I guess it's probably in the 2000 and in the early 2000s, right? Where you had that big computer monitor, and it was sitting in like a bowl looking thing, and it had that little bowl underneath it, and the monitor set down on it. And if you wanted to change the monitor height, what you did is you like slid the monitor in that little bowl back and forth, and you could slide it back side to side, or you could slide it up and down. If you guys remember that, if you don't remember it, it doesn't make any sense. But if you remember it, That to me is what's going on with that atlas. That atlas is holding up that skull, and then that skull is like sliding back and forth. So I had a patient say today, every time I start to listen to someone, I find myself tilting my head to the right. Like if I'm really concentrating on what they're talking about, my head tilts to the right. And I've got pictures of people that do that. Their heads tilt one side or the other. And from the time they're little kids, they've been that way. Well, you can just imagine all of the neurology that's going on with that. And why does that happen? Well, sometimes it happens because the neurology, the brain itself, tends to fall towards the flat side, just like a race car, a NASCAR. If you take pressure out of the driver's side front tire, it causes the car to tilt towards the left. And so when they're making those left-hand turns, that car is already tilting into the turn. So there's different air pressures in the left side tire and the right side tire in a race car to make that car tilt like that. Well, the same thing happens in our brain with our right hemisphere and our left hemisphere, that we can have these times where we're just sitting there and we're just tilted like that. Now, that can be like a neurology issue, what we call a hemisphericity, or you can actually have a mechanical issue with the way that atlas has slid on the occiput one way or the other. And you're like, well, what difference does this make? Like, why are you even telling us this stuff? Because what does it have to do with me? Well, your spinal cord is running right down the middle of all that. So if we go back and look at the x-rays again, and you say, well, where is the spinal cord? Well, the spinal cord is on the back of the cervical vertebrae. And then it's where these little lines come right here, where those spinous processes come together, and it makes a line on the x-ray. So you can see that the spinal cord is going from behind the bones to that spinous line right there. And that's where your spinal cord's going. So if your atlas, which is a ring, and your spinal cord, so let's look at it from the end right there. If that atlas is moving, that atlas can put pressure on your spinal cord. That's the whole philosophy of upper cervical adjusting technique. If you've known somebody that's an upper cervical guy, that's the only thing they ever want to talk about is just where's the atlas. And it's cute of them. I like that. I mean, I appreciate it. They're not lying to you. The atlas is very, very important. But it's not the only thing. But sometimes they think it is, and that's good. That's fine. We don't need to fuss about it. You don't even know what I'm talking about right now, but everybody in chiropractic knows what I'm talking about, because everybody knows an upper cervical guy, and then they think, well, that's the only thing that you should ever adjust. Hang on, I got all my stuff crooked here. Okay, so the atlas is right there, and then here comes the spinal cord. So if your atlas is out of place, it can put pressure on your spinal cord. And remember this study from the University of Colorado, that a dime's weight of pressure on a spinal nerve root can decrease the amount of energy flowing through that nerve by 40%. So it's 25 millimeters of mercury or whatever in pressure that you put on a nerve, you'll decrease the amount of energy flowing through that nerve. That's what we call a subluxation. The subluxation is the pressure on the nervous system, which is decreasing the flow of energy in that nerve. So that's where we start, is up there with the atlas, the occiput, how that whole thing is fitting together, right? But when we come down here, you got C2, you got C3, and then all of a sudden in this particular x-ray, we have a reversal of the cervical curve. It's this whole segment between C4, C5, C6, and C7 is bent the wrong direction. So now just think about what your spinal cord is doing right there. Like if we were to draw this out, and we said, how would your spinal cord be traveling through all that. So if we were to let's put these vertebrae, and I'll see if I can do it justice. That would be C2, and then C3, but then C4 is now bending in the wrong direction. C5 is bending in the wrong direction. C6 is bending in the wrong direction. And now we get back down to C7, and then T1 is built in the right direction. And so we get this, and we got this atlas that's going across the top of this in a ring in the back. And then we've got this line in the back of here on each one of these vertebrae. And that's where your spinal cord is going. Your spinal cord is coming out of your brain. If I can make it go there. It's coming out of your brain, and it's running down, and now it has to curve backward and then run down through there. And it's not supposed to do that. What your spinal cord is supposed to do in your cervical spine is it's supposed to run like this. It's supposed to be in a curve. But when you lose the curve in your neck and it's reversed in the middle, instead of your spinal cord running like it's supposed to, then what happens is it's going backwards. So just think of, and this is a really crude way of thinking about it, but just think about a banana. If you had a banana and a banana's got a curve in it, and you were to take that banana and you were to bend it the other direction, and let's just say that the skin of the banana didn't break. If you could just bend that banana forward, what would happen to the actual meat of the banana inside the banana itself? It would be compressed, right? And I bet you if you did that to a banana, if you leaned it forward like that and compressed it, but you didn't break the outside skin, and then you waited a couple of days, you would notice that there would be damage to the banana in that area. You would actually get compression on there, and then that banana would start to turn brown. If you peeled it 2 or 3 days later after that, you would have a spot right there in the middle of that banana where you'd have dead tissue because of the damage of the bending going on. Well, the same thing gets to a lesser degree happens whenever you have a reverse cervical curve. And it changes, if I've got impulses, and remember there's 3 trillion bits of information per second coming into this, I've got these impulses traveling up this spinal cord into the brain, and then I've got these impulses traveling out of the spinal cord back down to the body. Could I possibly have disruption in the signal that's going through that section? And the answer to that question is yes. And what will that mean to us? It means it changes the dynamics and the function of our nervous system. It changes, what if only 90% of those 3 trillion bits of information per second are getting to your brain? What if I only gave you 90% of your checkbook, your checks at the end of the month? You're trying to balance your checkbook, and I know nobody does that anymore, but what if I only let you see 90% of the information? What if I was a football coach and I only got to see 90% of the team I was getting prepared to play? Or if I only graded 90% of my players, if I only got to see them? Or what if I was a quarterback and I got in the huddle and I called a play and 90% of the people got it, but only 10% didn't get it? There's 11 guys, I'm one of them, so there's 10 other guys. I call a play in the huddle, 9 guys get it, but 1 guy doesn't get it. What do you think is going to happen? Total chaos, right? What about the snap count? What if I say we're going on 2 and 9 guys get it, but 1 guy doesn't get it and he jumps off sides? Then we're in trouble, right? That's what happens inside the body. Inside the body, when we have these reversed cervical curves, then we lose this input going into the brain. So now the brain is functioning on a totally different set of data. And it's trying to adapt. Remember, it's going to be alarm, and then it's going to try to adapt. And how will it adapt? Well, one of the ways it might adapt, if I had this type of curve going on, one of the ways it might adapt is it might pull my head forward. It might pull my head forward to try to take some of that pressure off the spinal cord. Like maybe that would change. And then what would that do to the biomechanics of my neck? What would that do to the muscles that are attached to the back of my skull? I might get a headache that starts right there and comes around to my eyeball. Like there's all kinds of physical problems that go on when we're dealing in nervous system interference. Now, I'm going to keep this picture right there, but I'm going to go back to the x-ray because what I wanted to show you was the bone spurring part of the x-ray. All right, this particular x-ray, there is lots of degeneration right here. Degeneration. Not arthritis, degeneration. I can't tell you whether or not this person's neck hurts. I can only tell you that they have degeneration. Okay? Then on the front of it, you have an anterior longitudinal ligament. Let me see if I can find a picture of that. The anterior longitudinal ligament, and wherever I get this from, they're just going to have to forgive me and see if I can find a good picture of it. Whoops. This is a picture of it that you can kind of see. It's a stock photo, so maybe that means we're okay with it. But if we were to look at a kind of a cross section of the spine right there, and we would look at this ligament. So you got a vertebra and you have a disc, and you have a vertebra and you have a disc, and on the front you have this anterior longitudinal ligament. This big thick ligament right here goes all the way from the top from C2 all the way down to your sacrum. This anterior longitudinal ligament. It's like a big old piece of duct tape that's running on the front of the vertebra. Now the spinal cord is back here in the back. It's not along the front. And so this front ligament, you're not supposed to see ligaments on an x-ray. X-rays are only supposed to see bone. So if you see this calcification on the x-ray, what you're seeing is this ligament that's becoming bone. It's the body is laying down bone in the middle of that ligament. And that happens all the time. Like the body will lay down bone in the rib cartilage. The body will lay down bone in a tendon. The body will lay down bone in joints. That's what bone spurs are. The body will start to build bone on the bottom of your heel when you have plantar fasciitis and you get a heel spurt. That's where your body's going to build bone. So any section, any joint that's not moving properly, the body's going to say, well, we shouldn't treat it like a joint. We should treat it like a solid bone. And so what happens in this case is we got all this degeneration that's going on, and we've got compression of the disc. And we've got compression of the disc, and remember that it's only the outside 1/3 of the disc that has nerve supply and blood supply. It's only 1/3 of the disc. And so what we have to do is we have to pump in there. And it's been a little while since we've drawn this picture. But if we draw this picture of one, let me see. Don't draw it with the red. Let's draw our vertebra, and then let's draw our other one. And then let's put the disc in between them, right? Blood supply comes into the vertebra. Then it runs up like a coolant, like we got coils of coolant that runs in there, and that blood supply runs up and down and up and down and up and down, and then brings itself back out. And it does that same thing with the disc, the vertebra that's above it. We got this whole blood supply issue, and it brings it right to the end plate on both sides, and then it brings it out of there. So what's going to happen is that blood, what do we need? Remember, we need fuel and activation. Fuel, activation. Most of the time what we're talking about with that is neurons, but it applies here too. We got to get the fuel to the disc. We've got to get the fresh glucose and oxygen into the disc so that the cells of the disc stay healthy. So we have to nurture those cells in order for them to stay healthy. So we've got to get them in there, but we don't have blood supply going up into the middle of that disc. So how do we get them in there? The blood will drop it off right at the end plate. Right at the end plate, it's going to drop off the glucose and the oxygen. So what do we have to do? We have to play it like a, what is that thing? A harp. Hang on. I went right to the break. Sorry, wasn't paying attention to the clock. Let's take a break. We'll be right back. We're going to come back and keep on talking about this stuff. And then I want to get into parasympathetic activity on the other side of the break. So you guys stick around. This is Life with Jason Clemens, DC, and we'll be right back. What is that thing called? An accordion, right? An accordion. That's how we keep that disc healthy. So people say, oh, I think if I get adjusted too much, isn't that bad for my joints? It's like, absolutely not. Like, you want your joints moving. You want your joints pumping. And if you do that, if you keep your joints pumping and you keep them moving, then it'll pump that blood into that disc, and it'll pump the trash that's left over from the disc out of the disc, and it'll keep that disc hydrated and nice and healthy. And if it doesn't, you're going to end up with degeneration in the joint. Look at this. That's what this is right here. This is degeneration in the joint. This section right here, there's almost no disc space left. And why? Why is there no disc space left? Because that segment between C4 and C5 and C5 and C6 and C6 and C7, that whole segment of that spine is compressed and it's not moving. It's compressed because it's reversed. Instead of being open, instead of it being bent backward like it's supposed to be, and you're not leaning your head back, your eyes are on the horizon, but your curve is supposed to be in a backward direction. Right here in the center of this curve, this section is forward. And because it's forward, it's compressing the disc, and over time, the disc wear out. And they'll say, wait a minute, it's just because I'm old, right? No, it's not because you're old, because this disc is healthy and this disc is healthy. This disc down here is healthy. It's these discs in the middle that are the problem. That because they're not moving properly. Hang on one second. Okay, everybody, we're back. This is Life with Jason Clemens, DC. We're talking about spinal movement tonight and disc, and we're going to talk about parasympathetics right after this, so stick around for that. But the main thing I wanted to talk about this X-ray, I finally want to get to it, is I want to talk about this anterior bone spurring, where you see these. Anterior means the front, and we've got some spurs. We've got some bone spurring going on right here. We've got some bone spurring. We've got some bone spurring right there. Okay, anterior bone spurring does very little damage to, like, it's not dangerous. I don't want to say it's not dangerous at all. There are some complications with anterior bone spurring, but you're a long way from the spinal cord or the spinal nerve root, which is back here in the back. This bone spur that's coming off the front right here of this particular x-ray is not going to affect the nerve. This bone spur is not going to put pressure on the nerve and make you have pain down your arm. It's not going to do any of that. What it will do, it could possibly, if it got big enough and thick enough, it could start to affect your swallowing. And what's even more important is if the bone actually welds itself shut. Like in this little segment right down here, if that bone spur finishes off and it connects to this one, what it's doing now is it's causing that segment to lose its ability to move. Now it's locking it down. You can just imagine if we just put a paste, like a cement, like liquid nail or something across the front of that, and we just locked it all down. Now what's happening is we're losing the ability to move. Now we still have joints on the back of the neck, and it's locked down on the front. It still might be able to pump just a little bit on the back side. We still might get some movement. But when we lock this segment down, then we lose the movement. And that is the point that it really starts to mess with you. Because now because you've lost movement, you lose brain input. Okay, if I take that same vertebra, and now all of a sudden I weld it shut, I'm going to take, let's see, it was 4 and 5, 5 and 6, 6 and 7. And I'm just going to make this really thick around through here. And then I'm just going to weld this section shut right there. And because it's backwards, and it's really looks more like this because it's all degenerative right in there, and it's degenerative right there. So there's almost no disc space left. And there's almost no disc space there, and that's all degenerative. And so now that whole thing is just nasty looking in there. And it's not moving. And because it's not moving, it is not firing input from this whole segment is not firing into the brain. So instead of 3 trillion bits of information per second, you're getting 2.9 something trillion bits per information per second. And it's like, oh, that ain't any big deal. Heck, how does that affect anything? You choose. You choose on how many bits of information you don't want to get into your brain. You choose how much data you want your brain to operate without. Some people think it doesn't make any difference at all, which is fine. It probably doesn't. It's fine. Your brain will just get along with it without it. But eventually it will cause some sort of pain in your neck, or eventually it'll cause the muscles in your neck to decrease. And then now the muscles and the ligaments around it start to tighten down. And now you can't turn your head as far. Now you lose your range of motion. And when you lose your range of motion, you lose more movement. Movement is life. And it's very important to have those things. But if you have an anterior bone spur, that bone spur is not going to hit that nerve root. You have to get a posterior bone spur in order for it to hit the nerve root. Then you can cause some problems with the nervous system. And that's something that you got to watch out for, because you don't want to rake those nerves across there. Yeah, accordion. Thank you, Isabel. You don't fix those compressed discs. I haven't really seen. The question is, how do you fix those compressed discs? You don't. You start to try to get the movement in whatever disc is left, and get those joints moving, because it doesn't mean, if you have those compressed discs, this is not a disc bulge. This is a degenerative disc. And the degenerative disc doesn't necessarily mean that your neck hurts. I can promise you, it looks horrible. That x-ray looks horrible, but I can promise you that person may or may not have neck pain. That's the problem with going to the doctor when your neck hurts. Because if you have neck pain, then you go to the doctor because you have neck pain, and the doctor takes an x-ray of your neck, and the doctor sees that, the doctor is going to say, oh my gosh, your neck is horrible. I mean, it looks like the neck of a 90-year-old, which I think is quite insulting to 90-year-olds, but they'll make some statement like that. And then they'll say, man, you've got all this degeneration in your neck. That's probably why your neck hurts. And it's not. It may or may not be that way. And I know that that's hard for you to believe, but that's a fact. It may or may not be that way. You may have neck pain and you may not have neck pain because of it. Now, do you have decreased input into your brain? Yes. Do you have decreased brain function? Yes. Could you have increased sympathetic tone? Yes. Could you have decreased parasympathetic tone? Yes. Could it lead to all kinds of chronic diseases inside your body? Yes. Is it, to me, what it is it's more of a narrative. It's more of a signal that there is something that's not proper inside your body. What we're doing is we're seeing the end. It's like I don't have to see the tornado that just went through the town. I could just see the town after the tornado. And I can look around and I can be like, man, there was a tornado here, right? I don't have to watch the tornado go through to say that there was a tornado there. I could just look at how the trees were pulled up out of the ground and the buildings were smashed and the roofs were ripped off and all that sort of thing. I'd be like, man, there was a tornado that came through here, right? That's the same thing we can do when we look at this x-ray. We can look at an x-ray like this and we can say that there's been some abnormal functioning going on inside this body. That's what we can say. And if the person's in the middle of it, then we can try to help them do something about it. So, yeah, there's a lot going on with the way that your spine is working. So that's that. Okay, let's move forward. Let's take the rest of the show, and I want to slow down, and I really just want to make sure. Isabel, I'll come back to well, I'll answer it real quickly because I can answer this one really fast. It says, side note, so what happens when you get a crick in your neck when you sleep wrong? The answer to that question is I have no idea. And I have asked that question for 20 years. I don't know. I can give you some ideas that I think you relax, the muscle moves, you definitely have a nerve involved. Why and how, I don't necessarily know how that works. I've never had anybody explain that to me. So I don't know. You get a crick in your neck, it's like your head's tilted this way. Is your head tilted this way because innate intelligence is trying to keep you from tilting your head left? So it's pulling your head to the right to keep you off of the nerve? Or are you having a muscle spasm over here on the right side that's pulled your head to the right? I don't know. I don't know which one it is. It's hard to know. One of those two, I think, but I'm not sure which one. And why did it happen? I don't know. So let's get into parasympathetic for a second. Because we made the statement. We made the statement a couple times yesterday of increased sympathetic tone, right? It says, for 100 years, chiropractors have asserted that overall health can be improved through spinal manipulative therapy or adjustments. That's what they've said. Spinal dysfunction affects autonomic nervous system. Studies have documented potential relationships between vertebral subluxation complex and the function of the autonomic nervous system, right? And then down here at the bottom, studies from Windsor and Core have claimed that problems with compromised spinal function is increased sustained sympathetic tone. Okay, that's That's the part I want to really slow down for a second. And I don't want to be boring, and I don't want to be uh, insulting to your intelligence. But it just struck me today that maybe I should really just slow this down just a little bit and and go over it go over it one more time and slow it down. And I know we've done it lots of times, but we um, it's layering of education, and it's layering of understanding, and it's when you read an article or you study, you look at an X-ray, or you do the things that we've done over the last several weeks, and you look at it and you say, okay, now I get what he's trying to say. Sympathetic nervous system is not. No, I'm not going to do that. Sympathetic nervous system. This is fight or flight. What does that mean? Well, fight or flight. You got to realize that when you study anything, in order for two people to communicate with each other, they have to come up with a word that they both agree upon, describes the thing, right? This is blue. This is pink. Now, who made that up? This is yellow, right? Okay, one of these pens is blue and one of these pens is pink. Okay, says who? Well, the very first person that decided to call this pink, like, I don't know, they could have called it anything, but they called it pink. And then everybody else just said, okay, I get it, that's pink. And then they said, this is blue. And they said, okay, we all agree. That's fine. If that's what you call it, we'll just call it blue. And then we just agree on it that that's what it's called. Okay, so it's just a name. So these guys that are studying the brain, for these Latin guys, these Greek guys, and all this stuff for years and years and centuries ago, and all this stuff, they were pretty smart, fellas, and they just made these big words up to describe a set of characteristics about a certain part of the nervous system. It's just, that's what it means. So they just came up with sympathetic stress. I don't know the history of it. I'm just telling you, they must have just come up with the word. But that's the fight or flight. So what they're describing is, when they say that, is they're describing the body reactions, the physiology, the physical reaction that the body has during this time of activity. And it's like, what are all of the things that the body is doing when it's increased sympathetics? When you have increased fight or flight, what is the body doing? It's preparing itself to run away from a threat, or it's preparing itself to fight a threat. If we're in a flood zone and all of a sudden there's a hurricane coming, what are we going to do? We're going to we're going to fill sandbags. We're going to start filling sandbags because we don't want the building to flood. So we're going to fill sandbags, and we're going to start stacking sandbags around the building, and we're going to get plywood, and we're going to put it on the windows so it doesn't break. Okay? While we're doing that, if somebody comes up and says, hey, y'all, I think we should paint the library at the elementary school, you're going to say, you're going to look at that person and you're going to say, what? No, not right now. We're not going to paint the library at the elementary school today. We got a flood coming. Like, we got a hurricane coming. Everybody in town needs to be over here working on these sandbags and putting up this plywood. We're not going to worry about painting the elementary school library right now. Right? It's not important in the moment. Your fight or flight response, your eyeballs are going to look at a threat, or you're going to hear a threat. If it's dark and you can't see, it's unknown anyway, and then you heard something. What'd you hear? And you're going to have some sort of perceived threat or unknown situation that's going to happen. And what your brain is going to do is your brain is now going to take all of its resources. It's going to take all of its energy. It's going to take all of its glucose. It's going to take all of its oxygen. It's going to take all of its adrenaline. It's going to take all of its resources that have something to do with fighting or running. And it's going to supply the part of the body that's responsible for fighting or running. And then it's going to take all of the resources away from any part of the body that doesn't have anything to do with fighting or running. That's what the sympathetic is going to do. It's going to steal from those areas, like digesting your food. Digestion is one of them. Okay? What did you have for lunch? Take whatever you had for lunch, and you're digesting your food, and then all of a sudden, there's a threatening situation that's kicking in. What are you going to, is your brain going to continue to digest the food? No. Your brain's going to be like, dude, why do I care about why would I digest food? What is it about digestion that's important? Tomorrow is important for digestion. Like, I need the nutrients in order to be alive tomorrow or the next day. Immune system is the same thing. The immune system is responsible for keeping me alive tomorrow or the next day. If I'm in the middle of a lion attack or a tiger fight, then I don't need an immune system, because my lifespan might only be 90 more seconds. Like, I might live for a minute and a half. Do I need an immune? Like, you could pour all the measles in West Texas on top of me in the middle of a tiger fight, and it wouldn't kill me, right? It wouldn't affect me at all. None of those viruses. You could pour AIDS on top of me. You could give me all COVID variants that there's ever been and pour it on top of me in the middle of the tiger fight. Wouldn't matter. Why wouldn't it matter? Because I'm not going to live long enough to get sick from a virus. So immune system function has to do with tomorrow and the next day and the next day. And that's another thing that gets stolen. Any of the excess energy that the body has is going to get pulled away from the digestive tract. It's going to get pulled away from the immune system. It's going to get pulled away from reproduction. Reproduction is definitely about tomorrow. It's going to get pulled away from posture. That's sympathetic tone. And that's what this article is talking about. It's talking about increased sympathetic tone. These studies have claimed that problems with compromised spinal function is increased sustained sympathetic tone. Increased sustained sympathetic tone is linked to immune system dysfunction, pain, vascular compromise, blood flow to an area that's not important in a tiger fight. Just name an area that's not important in a tiger fight. Your liver, your spleen, your intestines. None of those things. Why would I supply blood supply to the liver if in the middle of a tiger fight, if my brain knew I was only going to live for 90 more seconds? Does that make sense? So vascular compromise with subsequent additional neurological dysfunction, brain. How about most of the parts of my brain. What do I need most of the parts of my brain for, especially the upper part of my brain, if I'm only going to live 90 more seconds? I don't need any of that. Just send the information down to the brain stem where my respiratory centers are so that I can breathe and pump my heart. That's it. I can get oxygen there. I don't need the upper brain when I'm having an alarm response. That's part of the reason we check the pulse ox on everybody. We check the pulse ox and we say, look, what's your oxygen level? If you got one at home, check it. You can check it right now. If your oxygen at 654 is 92, then I could promise you at 4 a.m., you're dropping into the 80s. Between 4 and 7 a.m., you're dropping that oxygen down. That's vascular compromise. It's going to set off an alarm inside your brain. It's going to wake you up. That's what I'm talking about, okay? And reduced systemic health. Your whole body's going to be reduced in health when you have this sustained sympathetic tone. That's what sympathetic means. Okay, so they just had to come up with a word that they wanted to use to describe the opposite of sympathetic. And what does para mean? It's like around, like or close to or whatever, right? So what they did is they just said parasympathetic. And it's basically all of the opposite things. Now, parasympathetic is not fight or flight, it's rest and recover. What does that mean? I need to rest. I need to rest now. I need to go to sleep. I need to rest. I need to slow my heart rate down. Instead of it beating at 140 beats a minute, I need to slow my heart rate down and give my heart a chance to rest. I need it to beat at 72 beats per minute or 60 beats per minute, not 140 beats per minute. I need my liver to have a chance to rest. I need my digestive tract to have some blood supply now. I need to bring that blood supply back to my digestive tract. I need to supply my immune system now. I need to give the macrophages and the neutrophils and all of those things that are part of my immune system, I need to give them the nutrients that they need. I need to stimulate. Now reproduction becomes a thing that becomes important. If I'm going to rest and recover, I might live till tomorrow. Well, if I'm going to live enough tomorrows, I better reproduce so that there's somebody else that lives after me, right? That's when those things. And what does that mean to us? What does that mean to us? It means that if you're a woman, your cycles could be all screwed up because of increased sympathetic tone. Increased sympathetic activity could be messing up your menstrual cycle. Guys, your testosterone could be crashing because of increased sympathetic tone. We need to switch it over to parasympathetic. We need to, that's what I was talking about yesterday about that sphincter between your stomach and your esophagus. That sphincter is under parasympathetic nerve supply. So it's going to close down if your parasympathetic nervous system is ramped up and firing your parasympathetic nerves. If your parasympathetic nervous system is ramped up, it has the ability to slow your heart rate down. It has the ability to dilate indirectly your blood vessels, to decrease your blood pressure. It has the ability to increase your stomach acid. We get hormones. Your thyroid gland now works and your adrenal glands calm down and you go into parasympathetic rest and recover. And one thing that we know is that on a cell wall, if there's a cell and that parasympathetic nerve is connected to that cell, there's a receptor on the outside of that cell that fits that nerve. And what we know about chronic disease is that there is actually a deterioration. There's a deterioration, just like that X-ray, a deterioration. There's a deterioration of parasympathetic nerve connections to cells. And in chronic disease, we get to the point to where we now lose the ability, because of the degeneration in that particular connection, we lose the ability when we fire the parasympathetics to calm that cell down. Now we're in trouble because we're going to lead ourselves right into sickness. We're out of time tonight, but we're going to pick it up right here tomorrow night, and we're going to just continue to talk through this, because I think once you get it, it'll really make a lot of difference about the way that you really understand your health, and you control your health, and you understand what does a soda pop do for me, right? What are those things? What does a Snickers bar or a Reese's cup or any of those things have to do with the way that my nervous system functions, right? You guys have a great night. If you got any questions, let me know. And otherwise, I'll see you guys tomorrow. Thanks for watching this show.